COVID-19 vaccinations started being administered this week in 4 Springfield neighborhood clinics, providing greater access for local residents in hard-to-reach populations. State Representative Bud Williams of Springfield, along with other members of the Black and Latino Legislative Caucus, had urged Governor Charlie Baker to provide vaccines to the minority communities disproportionately impacted by the pandemic. Connecting Point's Ray Hershel spoke with Representative Williams to get an update on how the state is doing in rolling out vaccines to underserved city residents.
What we found out during the rollout at Eastfield Mall for vaccine site is that the system just wasn't working for a lot of marginalized, underserved communities. So we met with Commissioner Colton, Health Commissioner Colton of Springfield, Governor Baker at the state level, Secretary Sutters, and we said, hey, look, if you go out to Eastfield Mall and you look at the makeup of the community that's getting vaccinated, it's not many people of color. So this 211 system and the system you started before just isn't working. We have to figure a way to take this program to underserved, under-marginalized communities. That literally means to poor people, basically. So we're able to work with the state to create systems that we have. Now we have sites within the greater Springfield community. We have sites in Mason Square, at St. John's Church, J.C. Williams Community Center, South End Community Center, Harena School, New North Citizens Council. And we think it was very important that if we're going to get herd immunity and we want to get everyone protected, the most vulnerable people within the system have to be protected.
Representative Williams, the first of those neighborhood clinics you addressed at St. John's Church was held earlier this week. How did it go? What was the response like? And were things running smoothly at that clinic?
It was fantastic and fabulous. We had 200 doses, 200 vaccines that were given out on Tuesday morning from 9:30 to 12 noon. All the slots were taken. All of the people showed up, 100% of those who registered showed up, and it went as smooth as we could ever imagine. That just tells us that there's tremendous need within our under-marginalized community and an underserved community, that we have to take the program and meet people where they are. And that's what we did. We're going to meet people where they are. It's a lot easier and more convenient to get to a site within the Mason Square community or the North End or the McKnight neighborhood or the Old Hill neighborhood or the Upper Hill neighborhood than it is to get to Eastfield Mall. It takes work to get to Eastfield Mall. And a lot of our citizens just don't have the transportation, don't have the cars. And we're telling people don't take public transportation if you don't have to, because they're finding out getting on buses with a lot of people is not a safe situation.
Now, what are the status of these neighborhood clinics around the city? Are they going to be continually operating? Will you be getting the doses so that you'll be able to operate them on a regular basis for the people in need?
It's my understanding that we'll get 800 dosages a week. The state has set aside 800 dosages for the underserved, under-marginalized community. And it's for people who live, basically Mason Square neighborhoods and the North End neighborhoods.
Representative Williams, statistically, Blacks and Latinos have lagged behind the white population in terms of getting the vaccine. Why do you feel that's the case?
There's two things. There's some pessimism that exists between Black and brown communities in terms of trusting the health community. They really don't. There's a lack of trust, and there's a lot of evidence to suggest why there should be a lack of trust. The Tuskegee study and stuff, and there's other indicators. And the other piece is availability. It just hasn't been made available for people in the underserved and under-marginalized community. I think when they rolled this stuff out, you had to go to a computer to sign up. Most people in these communities don't even have a computer, Ray. Don't have access to the internet. I don't think when they rolled it out, if they had people in under marginalized communities in mind. Because no matter, when there's always a tragedy, whether it's a Katrina hurricane, whether it's a ice storm, whether it's a snowstorm, uh, people within marginalized communities are always dealt with in this way.
Now, Representative Williams, what's your message? How do you get people who are marginalized in these areas, as you've indicated, who are still reluctant to get the vaccines? What do you tell them? What's the message to them to be able to get that vaccine and for the future and for their health?
I started the Black COVID Coalition along with some other community leaders, Reverend Morgan and Andrew Cade, and we started trying to educate folks within the underserved, under-marginalized community. The statistics will tell you most people will take the vaccine based upon who took it. And it's not going to be a national story. It's not going to be on national news. It's going to be someone local, one of their family members, one of their friends, their clergy, their minister, their state representative, their city councilman. Those are the people who they're going to look at to get guidance. And when they see or find out someone who took the vaccine and they actually can touch and feel them in some kind of way, they will take it. That's how 60% of the folks have said they've taken the vaccine.
And overall, Representative Williams, are you generally satisfied with the rollout in Springfield? Are there still areas that need to be addressed as we move forward?
The rollout now, I was just up at Eastfield Mall a couple days ago. It's a whole lot better. There are no more lines. They're dealing with about 1,600 vaccines a day at Eastfield Mall. It's going pretty smooth. We have them in our community. We just need to get ready for, in about April or May, when the whole front opens up, where everyone's going to be eligible to get the vaccine. We're going to have to be ready, and we're going to need more boots on the ground. We're going to need more resources. We're going to need more doctors, more nurses. We're going to need more sites, because we have to get ready for this influx that's going to come. It's coming in April or May, whenever it really opens up. And I hope that we'll be ready for that.